disorders pertaining mainly to the protein energy malnutrition. Okay. Now today I'll be dealing mainly on uh, the references mainly I've taken from Robbins and Harrison. Okay. So first of all, to brief you, what I'll be discussing mainly will be the disorders and pathogenesis of air pollution. You all being in Delhi must have known how bad and polluted Delhi is. Diseases pertaining to the tobacco and smoking and alcohol. Tobacco smoking, you will be doing a bit more also when you do respiratory system, and alcohol when you do liver. But today I'll be dealing mainly on these two carcinogens along with air pollution. First of all, we should know what you understand by environment. The environment is the indoor, the outdoor, and the occupational settings in which the human being live and work. The air that we breathe, the food and the water and the toxic agents which we are exposed to, and that in further determines our health. Okay. So along with that, we should know about the personal environment, that is your tobacco use, alcohol ingestion, or recreational drugs like that. It can be the work environment, how bad the work environment is. Now, as because of COVID, the environment is very bad, so we are having all this online classes. So this is what defines environment: the outside air that we breathe and the personal environment. Okay. Coming to environmental disease, it is caused by exposure to chemical or physical agents in the ambient workplace or the personal environment, mainly, which could be on the nutritional disorders. I will not go in depth on nutritional disorders because we have gone through it early in the morning. Okay. Environmental disorders, you basically do not know what happens until and unless there is a severe outcome or everyone is covering on it on the internet or everyone is talking about it. Like the methyl mercury poisoning which happened in Japan in 1960s, dioxin in Italy, and methyl isothiocyanate which happened in Bhopal in India. You must have known about it. So this comes into work when you know about it. In air pollution, probably if you are in Delhi, you know more about it. But if you are in the periphery, you will not know much about air pollution. Okay. The toxins, you must have read about toxins more so in forensic medicine because this is what you have dealt about in forensic medicine. You must have seen how what all is there. This is just a picture which I've taken from the internet, what all toxins can be there. Why you need to know, I'll go in brief about what the toxin does to our health, what our body do to detoxify it, and what happens to the body when we are trying to detoxify it. They can be of the any, and it is what this picture depicts the toxin. Toxicology, if you have that in forensic, it is the science of poisons. It studies the distribution, effects, and mechanisms or actions of the toxic agents. You must have read about the organophosphate poisoning, which had happened in the forensic, right? And includes the study and effect of physical agents such as radiation and heat. Radiation, before with your senior batch, I used to cover it extensively, but somehow in the new curriculum it has been removed. Today I'm just mentioning it because it is asked, it's not been there, and this will be covered in your small group discussion. You will have a separate tutorial on radiation. Every year, if you must have seen to your recent senior question paper, you get invariably questions on radiation, be it acute radiation injury, chronic radiation injury, can be any. So you will have a separate lecture again on this. If not, it will be covered in the small group discussion as tutorial. Okay, so what is the mechanism of toxicity? First of all, we should know the threshold, what level the toxin should be present in the body to make its effect, and the portal of entry, whether it was ingested, taken in, whether it was inhaled, or entry is through the skin contact. How is it distributed within the body? What is the metabolism? It is metabolized in the liver or in the kidney. How is it excreted? And what is the toxic effect of this? Is what happens to the toxins that enter inside the body. So this is a picture which is taken from Robbins only, 10th edition. So the toxins which can be in the air, if it's polluted in the air, or if the water is polluted, or if it comes through the soil, what will happen? The absorption can be from the skin. The person has come in close contact with the skin, or if it's in the air, the person has taken in with the respiration, or if it's in the through the mouth, if it is the person has eaten. That is how it will be introduced inside the human body. So what will happen after that? If it's through the skin, they will further be absorbed into the bloodstream, then it will be further circulated throughout the body. And this is how it is metabolized and further excreted out. So these are all the reactions which occurs. I'm trying to brush up a bit about pharmacology. Okay, so if we have the phase 1 and phase 2 reactions, phase 1 occurs in the endoplasmic reticulum, makes them more lipophilic. It can be cytochrome P450 dependent monophilic system or the peroxide dependent coordination. In phase 2 reactions, it combines with the polar substance and makes it water soluble, which can be by this process. This is all about pharmacology, so that the toxin is excreted. The main purpose of our body is to excrete it and make it more non-toxic, so that it is removed from the body. This is all also a picture from Robbins, in which in xenobiotics what we do is we form a primary metabolite and a secondary metabolite, further which it is eliminated and excreted out of the body, because it cannot stay in the body, it has to be taken out from it. Okay, so these metabolites can be a non-toxic metabolite or a reactive metabolite. If it's a reactive metabolite, what will happen is that you must have read in new place what will happen to them. They will activate the enzymes, they will activate the receptors, they will destroy the membranes, or they can even destroy at the genetic level the DNA. So this what happens in that the toxins will be generated, and this will further lead on to carcinoma. This is what is happening. So our main role is what is happening and how do we remove it. If it's not removed, these all factors will lead into damage in our body. Coming on to the first topic, that is environmental pollution. You get a lot of short notes on environmental pollution, and you should read about environmental pollution. Okay, so first up, this is the picture on internet only, in which this is a most common outcome probably in, I think, 2019-20, the pollution level was down a bit because of COVID, but this is the view that you see in Delhi. It is the smoke, and here in this picture lower down, you will not be able to see the India Gate there. This is the situation in Delhi. This is what is the environment and what you take in inside your body and what damage it happens to the lungs, because this is where the air is taken in and then it is taken in the lungs. So air pollution, it causes significant cause of morbidity and mortality worldwide, not only in Delhi, almost worldwide. We know that we cannot live without air. It is precious to life, but the downside of it is polluted. It causes many potential airborne diseases and microorganisms in the developing country. And during COVID now, it is known that it is airborne. So we should always be wary about it. You might be seeing everyone with a mask. It's because the virus is airborne. Okay. So it also contains chemicals and particulate pollutants in the industrialized nations, not only in India. So the air pollution. as the name suggests, can be outdoor air pollution or indoor air pollution. It can be outside your home or inside your home in enclosed places. So when you attempt your answers, I suggest you go it as outdoor air pollution or indoor air pollution. The question can be or short note can be on outdoor air pollution or in indoor air pollution. So what do you understand by outdoor air pollution? It is the ambient air, especially in industrialization. They are contaminated with mixture of gases and particulate matter. So what pictures are shown before of the India Gate outside in Delhi, that is the outdoor air pollution. Smoke. Those who are residents of Delhi, or if you have stayed in Delhi for a long, you must have seen the smoke. Smoke is not the fog. In my state, what I see is fog, but in Delhi, when I came here, what you see is not fog, it is smoke, because it is combined with smoke to form the smoke. Smoke and fog combines the smoke. So it contains sulfur dioxide, carbon monoxide, ozone, nitrogen dioxide, lead, and particulate matter. The downside is lungs bear the brunt of adverse consequence. However, it may also affect many organs. Lungs mainly because they are respiring fluid, and it's the port of entry, which I have said in the previous slides. Okay? And many kids in Delhi have severe respiratory problems. Most of them are asthmatic compared to other states. It's mainly because the pollution is very high in Delhi. Ozone is one of the things which causes outdoor air pollution. This is produced by interaction of UV radiation, and often this is all about chemistry, and accumulates 10 to 30 miles above the Earth's surface. What is important is it protects life. It is absorbed the most dangerous UV radiation which is emitted by the sun. It is decreased in both thickness and extent because of the widespread use of carbon fluorocarbons, which is seen in air conditions and aerosol propellants, which is causing the destruction of ozone. What happens is that you have skin cancer. Sulfur dioxide is produced by, this is a bit, the topics are a bit boring, but you have to go all the pollutants. Okay, this is sulfur dioxide produced by plant burning coal and oil from copper smelting and byproducts of pepper mills. The air is converted into sulfuric acid and sulfur dioxide, which causes burning sensation in the nose and throat, as causing difficulty in breathing. Particulate matter, also known as soot, is a particular important cause of morbidity and mortality and related to pulmonary infection. Okay, so that was about outdoor air pollution, which is there. And this table is taken from Robinson. We have the pollutants, which is the ozone. We have nitrogen dioxide, sulfur dioxide, acid aerosol, and the particulates or the soot, which I have said. So the ozone, it affects the healthy adults, children, athletes, outdoor workers, and asthmatics, and decreases lung capacity, causes lung inflammation, and decreased exercise capacity. Nitrogen dioxide, it affects asthmatics and children, increase respiratory symptoms, and increase mortality. Sulfur dioxide, it affects the healthy individuals and asthmatics, and causes altered ciliary clearance, increased respiratory infections, decreased lung functions. Acid aerosol affects the children and healthy adults and increased respiratory infection. So out of this, what you can see is that it is affecting mainly healthy individuals, and the main site of infection is the lungs. So there is increased respiratory symptoms, which is because of it affecting the lungs. There is decreased lung capacity. Carbon monoxide, I feel you must have read about carbon monoxide poisoning in forensic medicine also, and I'll touch a brief on this because it's one of the components of your air pollution. It is a systemic affections, and the source is automobile exhaust, fossil fuels, and tobacco smoke. And carbon monoxide combines with hemoglobin to form carboxyhemoglobin, thereby decreasing the oxygen supply. So the patient is having hypoxia. So in chronic poisoning, what happens is that the hypoxia is very slow. and widespread ischemic changes is seen in the CNS, particularly in basal ganglia and lenticular nuclei. So, if you stop the exposure, the patient usually recovers. As I said, carbon monoxide binds with hemoglobin to form carboxyhemoglobin. We diagnose it by the carboxyhemoglobin levels in the blood. In acute poisoning, it is mainly accidental or suicide attempt. You see the cherry red spot of the skin with this characteristic. If death occurs, it occurs rapidly. Morphological changes may not be present, and longer survival, the brain may be slightly degenerated. So it can be, carbon monoxide poisoning can be acute or chronic. Now coming to the indoor air pollution, that was all about outdoor air pollution, the outside air that we breathe. The contributors of the outside air pollution, mainly it was affecting the lung, and healthy and children were affected. Along with that, we have studied about the consequence of the outdoor air pollution, and along with carbon monoxide. So indoor air pollution is mainly the tobacco smoke, carbon monoxide, nitrogen dioxide, and asbestos. This is what happens in the indoor air pollution. So in indoor air pollution, the cause may be the chemicals and materials from the building, the animal render, the skin of the animal that is there, along with the hair. There can be fungus or bacteria in the house, the chemicals and paints, and the volatile organic compounds which is found in the paints. It can be from the fireplace, it can be from the outside air which is coming inside your house, the electronic or broken lights, the cigarette smoking, the cleaning supply, all carbon monoxide. This will all cause the indoor air pollution inside your house. This picture in fact depicts what causes indoor air pollution. So, wood smoke of the nitrogen and carbon monoxide particulates and contains polycyclic hydrocarbons and causes lung infections, or it can act as a carcinogen. It can be microbial agent as I've depicted in the picture, which can cause viral pneumonia, legionnaires disease, or can cause even common cold. It can be from the pet skin, the dust mites, the fungi, which is responsible for the indoor air pollution. Radon is also said to be cause of indoor air pollution. It decay product is widely distributed in the soil and is prevalent in the home, especially in the basement. Okay, so if decay products are alpha emitters, 10% of the American homes. I'm stating this because the study is mainly based on the Western literature. So it creates risk of lung cancer. Okay, proper venting should be there so that it is not accumulated. Then formaldehyde, probably you must have seen this in anatomy. In pathology also we use a lot of formaldehyde. But if it's present in the indoor air pollution, what happens? It can be used in carpentry, in furniture, and adhesive, and it's mainly in poorly ventilated trailers. Concentration more than 0.5 parts per million or higher causes breathing difficulties, and it's classified as a carcinogen. There's a term which has been mentioned in Robbins, that is sick building syndrome, exposure to one or more indoor pollutants, which is mainly because of the poor ventilation. So ventilation is very much important to save yourself from indoor air pollution. That was all about indoor and outdoor air pollution. I'll touch a brief about metal lesser pollutants. It's given extensively in Robbins, but out of this, lead comes oftentimes. So I'm going to cover only lead. You can read about mercury, arsenic, and cadmium. And lead is one of the viva questions of the examiner. So I'll touch mainly on lead. So lead is classified as a heavy metal, and the source of exposure can be lead paint, from the plumbing, from ceramics, or industrial exposure. The route of exposure can be inhalational exposure or from household exposure. It's mainly in the paint. It is a divalent cation which is taken up by the bone and developing it in the children. Blood accumulates 5 to 10% of the lead, but it's rapidly cleared from the body. Lead in blood indicates recent exposure, and blood level does not allow determinant of total body burden. The remainder is distributed in the soft tissue, and expiation is via the kidney. So what are the effects of lead? It has a high affinity for sulfonyl groups and it's inhibited. So it leads to hypochromic anemia and basophilic stippling. This is one of the viral questions. What are the causes of basophilic stippling? And what you answer is maybe your lead. It causes sideroblastic anemia. Also, when you do HEMAT, you'll be taught about the hypochromic anemia, normochromic, and the macrocytic anemia. So it is one of the causes of microcytic hypochromic anemia. It competes with the calcium ions as a divalent and lead to competes with calcium, so it affects in bone remodeling. It has a inhibits the healing of the fractures by increasing chondrogenesis and delaying cartilage mineralization. Interferes with the normal remodeling of the cartilage and primary bone tuberculosis in the epiphysis of the children, and increased bone density is detected on lead lines. Okay, this is the picture from Robin Soddy and what happens to the body because of lead in the brain. It will lead to headache, memory loss in blood, which will be healing again in your HEMAT, anemia, basophilic stippling. In the peripheral nerve, there is demyelination, and in the kidney, you can have chronic interstitial disease in GI tract. There can be abdominal pain. In epiphysis of children, because it is a growing bone, you will see radio-dense deposits, and in gingiva, you have the lead lines. This is what I was talking about. In the red cells, you can see tiny dots, ribosomal dots. This is known as basophilic stippling. Here also we have the beautiful basophilic stippling, and we can have the lead lines because gingival lead lines on the gingiva and opaque density at the growing epiphysis of the young children. That was all about air pollution and the pollutants as a metal, which I've dealt about as lead poisoning with lead. And I would like to repeat again to those who have joined late that radiation injury I'm not covering, and radiation is a main question which comes in the exam. Let's go to another topic, which is about tobacco or smoking related health diseases. Okay. So tobacco, more than 2 million residents of the US died of smoking related. It is the most preventable cause of death in humans because once you stop smoking, all this gets reverted and it resolves a lot. Sometimes people die because of cigarette smoking. When you have, I don't know whether you have been exposed to the, whether you take histories now, because I feel because of COVID it's very limited, but when we were an MBBS students, when we get the patient with lung, we used to always take the history of smoking and back years, how many he smokes per day and for how many years. This is important because on this depends how much the person has more chance of developing carcinoma. So this is the average number of cigarettes that smoke each day multiplied by the number of years of smoking. So that you know the patient has high chances of carcinogenesis. One upside is if the patient ceases smoking, it greatly reduces the chance of carcinogenesis. This is what I said. If you compare this picture is also from Robbins. If you compare a person, the purple depicts the cigarette smokers and the yellow depicts never before. There is a reduction in the life capacity or expectancy of that person. So a person who smokes has a reduced life expectancy. There are several constituents in tobacco which has been implicated as a carcinogen. Nicotine is one which is addictive. Out of this, 60 some are well known. A lot of constituents are there. Tar, polycyclic aromatic hydrocarbons, they are carcinogenesis. You must have dealt of this in your neoplasia chapter. Nicotine, it causes gangliotic stimulation and depression and causes tumor promotions. The phenol, which causes tumor promotion and mucosal irritation. Benzopyrene causes carcinogenesis. Carbon monoxide causes impaired oxygen transport and utilization. Formaldehyde is toxic to cilia. You know the cilia is needed for mucociliary clearance and will cause mucosal irritation. Nitrogen oxide causes toxicity to the cilia and mucosal irritation. Nitrosamine causes carcinogenesis. There is organ-specific carcinogenesis in tobacco smoke. This is one of the favorite question of the examiner. You are given a lot of specimen and they ask what is the risk factors for it. So if you get any specimen of lung carcinoma, you'll be asked what is the risk factors. So you should know what tobacco smoking causes so that you can answer accordingly. We have various specimens in which there is lung carcinoma, bladder carcinoma. So you should know what causes, what is the which carcinomas are more common in tobacco smokers. So lung and larynx, the carcinogens are many. Please go through this in your Robbins. This is taken from Robbins only, and other esophageal carcinoma, the pancreatic carcinoma. What is the carcinogen and what cancer it causes? Okay. Cigarette in the workplace is because of asbestos exposure. Cigarette smoke is synergistic with radon and decay production causing lung cancer. It can exhibit symptoms of bronchitis, asthma, pneumoconiosis, and all. This will be dealt again in your lung chapter of lungs. So remember that it causes lung cancer. The smoking and lung cancer. What is the cause? What is the causal effect? Direct irritant effect on the tracheobronchial mucosa leading to increased mucus production, which can lead on to bronchitis. The polycyclic hydrocarbons and nitrosamines, they are potent carcinogens and involving development of lung cancer. Some of the cytochrome enzymes and phase 2 enzymes increases the water solubility of the carcinogen. So main thing is whatever is happening, they are forming disrupting the mucociliary clearance, they are forming water-soluble carcinogens, and they are forming DNA adducts leading to potentially oncogenic mutation and thereby to cancer. This picture should have come a bit earlier, but it's okay, just don't mind. So this is the cigarette smokes per day, which increases if there is a cigarette smoke per day increase or duration, the relative risk of lung cancer is increased. Okay, smoking and other diseases besides lung disease, they are linked to many malignant and non-malignant disorders and affect various organ system. I'll go one by one. So the risk of developing lung cancer is related to ataxia, smoke, and as I've said before, it's mainly increased. Coming to the cancer, we have cancer of the esophagus, pancreas, bladder, kidney, cervix, bone, marrow, carcinoma of the liver, and colon. I have a picture following this in which it will be highlighted. Besides the cancer of each of this organ, we can have non-malignant conditions associated with smoking. They are bronchitis because it irritates the tracheobronchial mucosa. They can also lead to recruitment of the leukocytes in the lung, leading on to emphysema, chronic bronchitis, chronic obstructive pulmonary disease, and even asthma, and increase the risk of tuberculosis. These are all lesions of the lung, inflammation of the lung, destruction of the alveoli, or it can lead to asthma or tuberculosis. Okay. Cigarette smoking is linked to atherosclerosis. So when you do CVS and vessels, you will be asked again on what are the risk factors of atherosclerosis. They are modifiable and non-modifiable risk factors, in which cigarette smoking comes under modifiable risk factors besides other risk factors. Myocardial infarction and stroke that increase in myocardial infarction is mainly because it causes increase in platelet aggregation. There is decreased myocardial oxygen supply along with increase in myocardial oxygen demand. So what happens is that the myocardium wants more oxygen, but the supply to the oxygen to the cardiac muscles is decreased, leading on to myocardial infarction. The aggregation is increased, the thrombi can be formed, and it can occlude the vessel and lead on to myocardial infarction. It also harms the developing fetus. They increases the risk of spontaneous abortions at preterm birth and results in intrauterine growth retardation. Several others have added several diseases in the recent Robbins. It was not there in all the Robbins. They have added, in fact, actually a lot of diseases. It causes increase in diabetes 2, type 2 diabetes, rheumatoid arthritis, age-related macular degenerations, ectopic pregnancies, and erectile dysfunction. Exposure to environmental tobacco smoke is someone proves to be smoking, that is the passive inhalation of smoke, as this is really bad. The relative risk of lung cancer in non-smoker is 1.3 times higher than that of non-smoker who are not even exposed to smoke. There is something about e-cigarettes which simulate cigarette smoking and delivering nicotine and flavor. This was not that important initially. It recently was added in the, I think, recent problems because there was an outbreak of vaping associated acute lung injury in 2019. That's why it was included. Initially, it was just as noted in the previous problems. This is a picture also from Robbins. So you should know all the cancers. This side is the left-hand side is the cancers and the chronic disease which has been highlighted. The red which has been highlighted, it's the ones which are newly added. So cancers can be of the oropharynx, larynx, esophagus, trachea, bronchus, lung. It can even cause acute myeloid leukemias, the liver. It can involve the stomach, kidney, the colorectal, cervix, and the bladder. A lot of the organs are involved. These are the chronic disease. It can cause stroke, blindness, age-related macular degeneration, periodontitis, the aortic aneurysm, CAD, pneumonia, asthma, COPD, tuberculosis, which I have highlighted. Can even cause diabetes, which is very recently developed by in 2016. Ectopic pregnancy can have hip fractures and a lot many which has been added now. Okay. That is all about your tobacco related diseases which can affect the human. So till now it was affecting mainly the lungs. In the smoking, you have to take the history of what is the smoke per year. There is if the smoking is stopped, it decreases the increases the chances of survival. And smoke has various new carcinogens, a lot of them, more than 60, out of which I have highlighted some of it. And you should know what all diseases it causes. It is one of the by-heart questions. Now coming to alcohol-related disease, I believe you must have seen some of the lesions which I'll be showing subsequently, and especially the liver, and this will be dealt again in liver. It will be just touch in liver. The pathogenesis won't be dealt much in the systemic pathology. So alcohol causes more than 80% annual deaths, and 50% of the deaths from accidents caused by drunken driving. It's mainly because of the influence under alcohol. The deaths are because of cirrhosis of the liver, in which cirrhosis is defined as the main three criteria. If there is regenerating nodules, distortion of the liver architecture, and fibrosis. So the liver will be fibrotic, and you'll be able to, I have a picture of that also, I'll show it properly. So it is 14 million of the adults suffer from alcohol abuse disorders. It is a chronic relapsing disease characterized by impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. This is a definition. That's why you can't miss any of this point. Then it is approximately worldwide 3.3 million deaths per year, which is 5.6% of all deaths. So define alcoholism. How do you define it? Alcohol use disorder. This is a table from Harrison. This is the classification of alcohol use disorders. This is the criteria, and you have to know what is the mild, moderate, or severe alcohol use disorder. So 2 or more of the following items occurring in 1 year or 12-month period must be enrolled for the diagnosis of this. Okay, the first is drinking resulting in recurrent failure to fulfill role obligations, recurrent drinking in hazardous situation. They know that it's hazardous, but they keep on drinking, continue drinking despite alcohol-related social or interpersonal problems. The patient has developed tolerance. There is withdrawal or substance use of relief, avoidance of withdrawal, drinking in large amount or for no longer than intended, persistent desire or unsuccessful attempts to stop or reduce drinking, great deal of time spent abstaining. It is a lot of this. You must have heard about gauge questions also, alcohol craving. So they have to know the criteria for alcohol use, alcohol use disorders to kill as mild, moderate, or severe. Legal intoxications, a lot. Some of you must be driving, and they should know what is the legal intoxication. It should not be more than 80 milligram per deciliter. So this is the chart for the alcohol impairment. What is the legal intoxication? What happens? There is a separate for female also, actually, because they exhibit increased susceptibility to alcohol. So the chart for the male and female are different as for alcohol impairment chart. The reference is given underneath this. So this is also from Harrison, and it is the effect what happens at various level of alcohol in which the person is not an alcoholic, in absence of tolerance. So it is not an alcoholic. So what happens to the person who is drinking alcohol? If the blood level is 0.02 grams per deciliter, there is decreased inhibition or the slight feeling of intoxication. You might have seen the person becoming a bit talkative. If it's 0.08, there is decrease in complex coordination, function, and motor performance. That's why they are not allowed to drive with more than that. If it's 0.2, the speech becomes slurred. There is motor incoordination, irritability, and poor judgment. If it's 0.3, light coma and depressed vital signs. And at 0.4 grams per deciliter, it causes death to the patient. So this is the level of the alcohol in the blood through which it can progress at different stages. So death occurs if the person's blood glucose level is 0.4 gram per deciliter. The metabolism of alcohol occurs mainly by three main enzymes: the cytochrome, which is the microsomal, the majority of which is hydrolyzed by in the cytosol by alcohol dehydrogenase, in the cytosolic, which is about 80%, and acetaldehyde is formed. Acetaldehyde is the main product which is formed and which is the main result for all the manifestation of alcoholism. The CYP21A is involved when there is such its alcohol level is at a much higher level, than this becomes into play. The paroxysmal bidecatelase is about roughly about less than 5%, and it occurs the paroxysm and it forms acetaldehyde. So the main product of this is the formation of acetaldehyde. The utilization of microsomal CYP2E1 should be known, because if this is used, what happens is this also metabolizes your acetaminophen and your cocaine. So if alcohol is used in place of this, the toxicity of acetaminophen and other drugs which have been metabolized by it will remain in the liver and they will become toxic. Okay, so this use should be, this is how the toxicity of acetaminophen occurs when the level of alcohol is very high. That is, if it's the cytosolic, if the level of alcohol in the cytosol is high, then only the microsomal is comes into play. The acetaldehyde which forms is further converted into acetic acid by the alcohol acetaldehyde dehydrogenase, which utilizes NAD plus, and NADH is formed in that. So there is a reversal of NADH to NAD ratio. This acetaldehyde is further can be used for fatty acid oxidation. So if NADH is not there, there is no fat oxidation in the liver, thereby forming your fatty acid change or the fatty change in the liver. This is another simplified version which I found from Harrison. It is the simplified version of what you have in Robbins. So by the same microsomal enzymes, by alcohol dehydrogenase form acetaldehyde and then form acetate, and acetyl-CoA this form metabolism of the acetic fatty acid. Sorry. So acetaldehyde is a direct product of alcohol oxidation. Toxic effect is responsible for some of the acute effects of alcohol. Alcohol oxidation by alcohol dehydrogenase leads to reduction of NAD, decrease in NAD and NADH is required for fatty acid oxidation of the liver. So there is an increase in NADH by NAD ratio leading to lactic acidosis along with accumulation of fat in the liver. There is reactive oxygen species generation because of the metabolism of liver by the CYP2 enzymes, which causes lipid oxidation of the hepatocyte membrane. So there is accumulation of fat in the cytoplasm of the liver or the hepatocyte, allowing destruction of hepatocyte membrane. Alcohol also releases endotoxins from the gram-negative bacteria in the intestinal flora. So there is hepatic injury going on along with the fatty chains which is going on. So the adverse effect, that was all about pathogenesis. So when you are asked the pathogenesis of the ethanol, you should write all about the table which I have said before, the picture which I have highlighted. That is the pathogenesis, how and which component is causing the injury. That is the fatty acid change, the destruction of the liver, membranes, and so forth, and or formation of the lipoproliferative from the gram-negative bacteria. So the effect of alcohol can be of acute or chronic. What happens if there is acute intoxication and if there is a chronic, the person has been drinking for a long time. So acute effects mainly affect the CNS, the liver and the stomach. This reversible if alcohol consumption is discontinued. The moderate intake of alcohol, multiple fat droplets accumulate in the cytoplasm of the hepatocyte, fatty chains or hepatic steatosis, which you must have seen by now. In the GI tract, it causes acute gastritis and ulceration. So the patient will complain of pain in the upper abdomen. In CNS, is a depressant, and as shown before, what happens can lead to death. First, affecting the subcortical structures with modulated cerebral cortical activity. There is stimulation and disorder cortical, motor, intellectual behavior at higher blood levels. It causes respiratory arrest and may cause death. That was all about acute injury. Coming to the chronic injury, if the person is taking for a long duration of alcohol, what happens to the body? In the liver, there is the main side of chronic injury. There is fatty change, alcoholic hepatitis, and cirrhosis. Cirrhosis associated with portal hypertension and increased risk of development of hepatocellular carcinoma. It's very much important. A lot of questions come from fatty chains, alcoholic hepatitis, cirrhosis, and portal hypertension. But questions which are seen to not mostly autopsy finding in a case of portal hypertension following cirrhosis. So fatty alcohol and the liver, you get short note on this. This is very much important. We have a specimen in our museum, so you should know about alcohol and the liver and fatty change. Present in 90% of binge and chronic drinkers, liver is enlarged, but patient is asymptomatic. So it comes mainly for asymptomatic increase in liver enzymes or when they are doing an ultrasound for some other unrelated thing, they find that the liver is enlarged. The changes are reversible, so you must have read about reversible and irreversible injury. So if the patient stops drinking, it will revert back to normal. It can be micro or macrovascular cirrhosis in alcohol hepatitis. It occurs in alcoholics and develop alcohol hepatitis, may have symptoms and jaundice because the liver is now damaged. Okay? There can be Mallory bodies. Mallory bodies are actually highly eosinophilic and made up of intermediate keratin filament. I have a picture and I'll show you this. And there can be alcoholic cirrhosis. We also have a specimen of cirrhosis. So this is a picture which I feel this must have been shown to you. This is a history is of a 50-year-old male, known alcoholic. The mounted specimen is a slice of the liver. So what is your diagnosis? Can any one of you tell me what could probably be this patient having? Or all of you are now sleeping? Anyone? Okay, this specimen has been shown. I cannot see anyone's answer. This specimen was shown to you before also. What you can see is the enlarged liver. Okay, the the capsule seems a bit tense up. You can have prominent markings, vascular markings, which is in the liver, and it is yellowish and greasy in color. Okay, so it is the capsule seems very tense. You'll feel as if it is rounded off because the capsule is stretched to its capacity. So it is a specimen of fatty liver. When you do a section of this, you'll be able to see microvesicular or macrovesicular statosis. Okay. So the history which can be expected in your MCQs or in your exams is classically of an alcoholic with a specimen which has been given like this, and you have to know describe the specimen. You should describe the specimen as yellow, vaccine color. It is enlarged. There is rounding of the liver because this enlarged. It becomes very tensor because liver is enlarged. The capsule is not enlarged. It is just the liver which is enlarged. So the diagnosis is your fatty liver. So this is a reversible injury. See these extensive areas of fatty liver, you can see all fat bags. We see this as empty, and we describe this as empty because during processing it gets change because of during processing, when you process the sections, these dilene dissolves it. Okay, that is why we can see all empty spaces. This is another view of your fatty liver in which you can see a lot of, you feel like it is holes. It's mainly because of fat. You can see micro as well as macrovesicular. Micro is when there are small droplets, and macro it is extensive. It's like as if you are seeing a section from the fat. Okay, but you can see residual hepatocytes nearby. Okay, so this is what you see in statosis. And in alcoholic hepatitis, what you see out here is this is what you see. Oh, sorry. The medullary dying bodies, can you see in the insert? There is a large eosinophilic robe-like inclusion. This is what you classically say as medullary dying bodies, and it's seen in alcoholic hepatitis. Alcoholic hepatitis, there is inflammation. You can see inflammatory cells out here. You can see the lymphocytes out here. And this happens when there is irreversible injury. So the liver has gone into irreversible injury. Fatty change and fatty change, we just have the reversible injury. Okay, then comes the next one. Okay, you might be seeing a lot of R in yellow and some fat. This R is actually the regenerating nodule. Okay, and the F is the fibrosis. So what has happened in this beyond the hepatitis, alcoholic hepatitis, it has undergone a large extensive areas of fibrosis, and the liver is regenerating. So this regenerating nodule, fibrosis, and the distortion of liver architecture is what makes cirrhosis. When you see this in the gross, you'll be able to see a lot of distortion of the liver architecture. You can even see some inflammatory cells. So when you do a special stain on this, when you do Mason cytochrome on this, you'll be able to see this fibrosis as blue. Okay, next question is a 45-year-old alcoholic presented with abdominal distension, bleeding per rectum and hematemesis. His bleeding could not be controlled and he breathed. His last abdominal organ is shown. This is a museum specimen, and this is how your exam will go. If the COVID persists, this is how it will go. You will be asked to describe this. So what you will describe mainly is distortion of liver architecture. Then you have these nodules which you have out here is what you see as grossly as nodules, small elevation. It is not smooth. That is what this is having. This is a case of cirrhosis. And the alcoholism is the main risk factors which is causing this. You should know that, and what all complications. I have said before, the person will have hepatocellular carcinoma. He will end up with hepatocellular carcinoma, and in the history, the patient died. Okay, so in GI, as the history before, there can be massive bleeding along with gastritis and gastric ulcer from the esophageal varices. You must have heard about the caput medusae, the prominent vessels in the abdomen. In neurological effects, we can have vitamin B1 deficiency in chronic alcoholics. So the principal lesion is Wernicke-Korsakoff, which I'll be dealing with it here. This is the neurological manifestation of alcoholism. So Wernicke's, what happens? This is acute, there is confusion, ataxia, and diplopia with ophthalmoplegia and damage of the medullary bodies. This is because of thiamine deficiency, and it is acute and reversible when you give them vitamin B1. In Korsakoff, what happens is that this is a chronic condition. There is short-term loss and confabulation. Confabulation means the patient is confused. They are unconsciously filled with misinterpreted knowledge. They are not actually lying, but they are confused. They are not sure what they are saying. It also results from thiamine deficiency and may be seen in other gastric causes, which leads to vitamin B1 deficiency. In cardiovascular effects, I have diverse effects on the cardiovascular system. There is injury to the myocardium, so there will be alcoholic cardiomyopathy. There is increased chance of hypertension and alcohol consumption with liver injury that result in decreased level of HDL, increasing the coronary heart disease. Risk of coronary heart disease. It can also cause pancreatitis. One of the most common history you take when a patient ends up with pancreatitis is whether the patient is drinking or not. He had alcohol intake or chronic alcoholic. So in fetus, it causes fetal alcohol syndrome. That's why the pregnant females are advised not to drink alcohol. It's characterized by microcephaly, causes retardation and facial abnormalities, and reduction in mental function. Carcinogenesis, incidence of oral cancer along with smoking, esophagus and liver. Women low to moderate intake, they have high risk of breast cancer. Malnutrition is a substantial energy source, so it causes deficiency of vitamin B, thiamine, and causes malnutrition. This is the gist of what I have discussed till now. In the liver, the fatty chains, acute hepatitis, alcoholic cirrhosis, nervous system, Wernicke's and Korsakoff mainly because of vitamin B1 deficiency, peripheral neuropathy and cerebral degeneration. In the cardiovascular system, cardiomyopathy, hypertension. There is supposed to be one more. Okay. So, however, moderate amount of alcohol can be protective against coronary heart disease because it increases HDL. But this heavy intake which causes decrease in HDL. Okay, so that this has been shifted a bit in GI tract. It causes gastritis and pancreatitis. Fetal, this which I've said before, growth retardation, mental retardation, and birth defects and carcinogens which can occur in them. So that's it all about today. Stay safe and try to maintain all COVID protocols. I don't know when the class will start, and offline will be there till May. Also will be going ahead with the classes which we have now, and you will have an assessment after 2 weeks on hypersensitivity. I have scheduled tutorials from 3 to 4. Next week also you will have tutorials. There will be one lecture every week on Thursday and Friday now. There is a slight change. 12 to 1 you'll have your lectures, and after the small group you'll have your tutorials. And I would request each one of you to just message me personal window for 1 month batch each, so that I can give you the phone number of your batch teacher. You make a group separately with them, and then you can go ahead with your tutorial the way it was. You will not have to ask me the link in the group. You just ask in that group. So each one of you from each batch, that is batch A1, A2, A3, A4, and C or B, each one of you message me and say I am from batch. I'll give it to only one person who messages me the two teachers' phone number. You can make a group out of there, and that person will send you the link. Okay, and you will have your tutorial there, and the assessment on hypersensitivity, that lecture I have taken today, and to morning's lecture, you will have it on 2 weeks after that, after this, what I have told you, Monday, right, Thursday. So you will have it, and it will be on your Google form as been before. Okay, so study till that time, and you will have your assessment also.